Hi, and welcome to today's Daily Chronicle. Today is Monday, October 20th, 2025. The CDC says people must consult a health professional before COVID shot. The Centers for Disease Control and Prevention Monday accepted controversial new guidelines for the updated COVID 19 vaccines that could make it harder for many people to protect themselves this winter compared with previous years. Acting CDC Director Jim O'Neill agreed to the recommendations for the COVID shots from Health Secretary Robert F. Kennedy Jr.'s hand-picked advisory committee on immunization practices, which met in September. Unlike in earlier years, the new guidelines call for people to talk to a doctor, pharmacist, or some other healthcare provider about the risks and benefits of getting vaccinated before they get a shot. This extra step is called shared decision making, or individual based decision making, according to the language in the press release. The move is the final action necessary for implementing the new guidelines, which affect who can get and give the COVID shot, and whether vaccination will be covered by private and government insurance without co-payments. Final recommendations were delayed. The step came after an unusual unexplained 2-week lag between when CDC advisors issued the recommendations and the agency accepted them. The official decision allows the CDC to finally start shipping vaccines to doctors, clinics, and other providers through the Vaccines for Children program, which provides vaccines free to about 40% of all U.S. children. Informed consent is back, O'Neill said in a statement announcing the step. CDC's 2022 blanket recommendation for perpetual COVID-19 boosters deterred healthcare providers from talking about the risks and benefits of vaccination for the individual patient or parent. That changes today. Independent vaccine experts challenged that claim. There is no basis to claim that routine recommendations prevent doctors from discussing risks and benefits with patients, said Dorit Reese, who studies vaccine policies at the University of California, San Francisco. Doctors have always been required to get informed consent. Shared clinical decision-making simply signals the vaccine is not routinely recommended and decreases uptake. Others agree O'Neill's claim is false and could undermine public confidence in the vaccines. The claim that the past recommendations deterred healthcare professionals from talking to patients about risks is completely untrue, and that is another example of the misinformation and made-up information that this administration continues to release to the public and further creates confusion and distrust in healthcare providers and vaccines, wrote Dr. Tina Tan, the president of the Infectious Disease Society of America, in an email. This is extremely unfortunate and critically increases the American public's risk for serious vaccine-preventable diseases. The CDC also formalized a recommendation that makes it more complicated for some parents to get their babies vaccinated against measles, mumps, rubella, and chickenpox. If that's his approach, I'm concerned about additional childhood vaccines recommended for routine use. Reese added in an email, if he thinks a routine recommendation undermines informed consent, which it doesn't, that could further reduce uptake and may make the Trump-Kennedy outbreaks of measles and pertussis we are seeing even larger. The moves guarantee continued insurance coverage for the COVID shots and allows pharmacists nationwide to keep administering the vaccines. but the changes withdraw some government coverage for the combination shot that protects against measles, mumps, rubella, and chickenpox, and that some parents prefer. In previous years, the COVID-19 vaccine have been easily available for free to anyone 6 months and older by simply walking into a pharmacy, doctor's office, or clinic and asking for a shot. Barriers to vaccination. But the vaccines became harder to get in August when the Food and Drug Administration approved updated versions of the Moderna, Pfizer, BioNTech, and Novavax vaccines, only for people at increased risks for serious disease because they are age 65 or older or have some other health issue. The change occurred because top Trump administration health officials say they have concerns about the safety and effectiveness of the vaccines. Even though there is overwhelming evidence the vaccines are very safe and highly effective. Federal health officials also argue that most people have so much immunity now that they don't necessarily need annual boosters anymore. Many public health experts agree that COVID no longer poses the serious risk it once did to many people, especially those who are younger and otherwise healthy. Other countries have also shifted to more risk-based COVID vaccination strategy. But some healthy people still want to get vaccinated to reduce their risk of getting sick at all, missing work or school, developing long COVID, or spreading the virus to vulnerable people, such as older family members and friends with other health issues. Over the past month, the change caused anger, frustration, and confusion. In states like Georgia and Utah, people had to get a prescription to get a shot, and some couldn't get vaccinated at all. The situation has further complicated because Kennedy, who has a long history of criticizing vaccines, said the government was no longer recommending the vaccinations for pregnant women and healthy children, even though pregnancy is listed as a risk factor by the CDC and FDA, and COVID can still make some kids very sick. Earlier this month, the vaccine panel, which gives influential advice to the CDC, voted to recommend the shots for anyone 6 months and older, provided they consult with a healthcare provider about the risks and benefits. Confusion still reigns. The requirement for shared clinical decision making creates a new hurdle to getting vaccinated compared with previous years by explicitly requiring a conversation with the provider on an individual's risks and benefits before they get one. The new guidelines continue to ensure coverage by private and public insurers, including Medicaid, Medicare, the Vaccines for Children program, and the Children's Health Insurance program. The recommendation should also clarify that anyone aged 6 months and older is eligible for the COVID vaccine, including healthy children, pregnant women, and younger adults. The only way to protect younger babies, who are also among those who face the greater risk from COVID, is by immunizing their mothers during pregnancy. But some providers may remain confused or hesitant to administer the shots because of lingering uncertainty and mixed messages. For instance, speculative safety risks presented during the CDC's advisory committee meeting that are not backed by solid evidence. Some states and major medical groups, like the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, and the Infectious Disease Society of America, have issued separate guidelines recommending the shots to most everyone ages 6 and up, and to protect themselves and their communities this upcoming respiratory virus season. In addition, more doctors' offices may opt against stocking the new vaccines because of concerns the debate may further dampen demand, requiring people to go elsewhere, such as a pharmacy. Some pharmacies may require patients to read and fill out a form that discusses the potential risks and benefits of the vaccines. But CVS, the nation's largest pharmacy chain, says people will be able to get a COVID vaccine simply by asking for one. Pharmacists won't have to require anything, including a conversation, unless patients have questions, CVS says. A separate shot for chickenpox is now recommended. O'Neill also accepted the panel's vote to ban the MMRV combination shot, which protects against measles, mumps, rubella, and varicella, or chickenpox, for children under 4. Young children can gain the same protection by getting separate shots for MMR and varicella, and most of them, some 85%, already do, according to CDC data shared and discussed at the advisory committee's September meeting. That's because a combination shot is associated with a slightly higher risk of fevers. They can also lead to seizures in kids under 4. Because of the risk, the CDC has for more than 15 years preferred that children under 4 receive the shots separately. Still, some parents were choosing to get the combo shot because it is easier and more available, and the risk is associated with the potentially frightening but temporary side effect is low. Because the recommendation, the MMR vaccine will no longer be covered by federal programs that offer subsidized vaccines. This panel has made a recommendation for a practice that's essentially in place anyway, but removed the option of those having vaccines financed for those who may think this is a better option, says Dr. Katrina Kritzinger, a medical epidemiologist who worked on vaccine policy for more than a decade at CDC, before retiring from the agency in 2023. This is effectively removing a choice from parents. Making different policies from the same safety information that was thoroughly examined years ago will also raise mistrust among parents, Kretzinger says. There is confusion about how to proceed, and also doubts raised by the fact that this is being re-examined, she says. It furthers a chilling effect on vaccine uptake. The change may also cause shortages of the separate vaccines, at least initially, until manufacturers can adjust their production to meet the new demand. A fresh call to break up the MMR vaccine. A few hours after issuing the new vaccine guidelines, Acting CDC Director O'Neill also called on makers of the combined MMR vaccine to break it up into 3 separate shots for measles, mumps, and rubella in a post on X.com. The post praised President Trump for his leadership and reposted his call in September that the MMR vaccine be administered as 3 totally separate shots. The combination shot for measles, mumps, and rubella has been used in the U.S. for decades. This really is absolutely completely ridiculous and really sets us back over 50 years in time, given that the MMR vaccine was licensed here in the U.S. in 1971, said Tan, president of the Infectious Disease Society of America. In an email, it was a combination vaccine to ensure that persons would receive all vaccinations that they would need as a single shot as opposed to 3 separate injections. This is crazy and continues to erode the public health system and the public trust in vaccines. There is no published scientific evidence that shows any benefit in separating the combination MMR vaccine into 3 individual shots, said a statement from Merck, which makes an MMR vaccine. Use of the individual components of combination vaccines increases the number of injections for the individual and may result in delayed or missed immunizations. The statement also said that evidence suggests combination vaccines improve outcomes for kids by increasing completion of recommended vaccines and getting them at the right ages. Merck also said there are no single-shot vaccines approved for use in the U.S. for measles, mumps, or rubella. Combination vaccines play a crucial role in improving vaccination coverage rates. Their safety and efficiency have been demonstrated by decades of research, said in a statement from GSK, maker of the other MMR vaccine available in the U.S. By reducing the number of separate injections required, combination vaccines allow for simpler and more efficient immunization process, which is essential for timely protection against disease. Israel strikes Gaza as both Israel and Hamas accuse each other of breaching ceasefire. Hamas members search underground for the bodies of Israeli hostages in Khan Yunis in southern Gaza on Sunday. Also on Sunday, Israel said it traded attacks with Hamas in the Rafah area, threatening the fragile ceasefire. Israel's government said Sunday it struck dozens of Hamas terror targets across Gaza in response to earlier attacks against its troops by Hamas militants in southern Gaza, a sudden escalation of violence that threatened to derail a fragile ceasefire that's been in effect for less than a week. Hamas responded that it was not involved in any attacks and was committed to the ceasefire. Israel's military said Sunday that terrorists had attacked Israeli troops operating in the Rafah area with gunfire and anti-tank missile. In response, Israeli Prime Minister Benjamin Netanyahu directed that strong action be taken against the terrorist targets in the Gaza Strip, his office said in a post on X. Israel's military said it struck the area to respond to the attacks and also to dismantle tunnel shafts and other obstructions used by Hamas, calling the violence against its troops a blatant violation of the ceasefire agreement. The military later said that the strikes had targeted weapons, storage facilities, firing posts, terrorist cells, and additional Hamas terror infrastructure. Hamas said in a statement that it had been cut off from its remaining groups in the Rafah area and was unaware of violence taking place there, and added that it remained fully committed to the ceasefire agreement, the BBC reported. Hamas official Izzat al-Rishq also accused Israel in a statement on Sunday of violating the deal and fabricating pretexts to justify its crimes. Hamas has been carrying out a deadly crackdown against rival militias and clans in Gaza, but it's unclear if Sunday's violence was connected to that. The U.S. Department said Saturday that it had credible reports that Hamas was planning an attack against Palestinian civilians that would violate the terms of the ceasefire. Israel's military said after the back and forth attacks on Sunday that it was resuming enforcement of the ceasefire. The Associated Press reported that Israel had halted aid into Gaza following the attacks, but later decided to resume deliveries on Monday. Net said in a statement that 2 Israeli soldiers, Major Yanviv Kula and Staff Sergeant Itay Yah, were killed in the clashes. One day earlier, an Israeli attack on a bus in Gaza City killed a family of 11 people returning to visit their ruined home. According to Gaza health authorities, the family included 7 children, the youngest of whom was 5 years old. Israeli forces said the bus was beyond the yellow line and Gazans have been warned not to cross, and that troops faced an imminent threat before firing a tank shell at the vehicle. Gaza's media office has accused Israel of violating the ceasefire agreement 80 times since it took effect. Al Jazeera reported. The ceasefire agreement, brokered by the U.S., included the release of all of the remaining 20 living Israeli hostages held in Gaza, following the Hamas-led October 7th attacks more than 2 years ago. In exchange, Israel released nearly 2,000 Palestinian prisoners. Hamas has also returned the bodies of some Israeli hostages who died in Gaza. Israeli officials identified the bodies of 2 hostages returned from Gaza late Saturday as Ronan Engel and Santaya Okarsi. Engel, 54 when he died, was killed while trying to protect his family during the October 7th attacks. His wife and daughters were freed by Hamas that November. Oak was a Thai national who was killed in October 7th attacks. 16 diseased Israeli hostages remain in Gaza, according to Israel's government. The Israeli government says 1,144 people were killed in the October 7 attacks led by Hamas in 2023. In the 2-year war that began in the wake of those attacks, Israeli forces have killed more than 68,000 Palestinians in Gaza, according to Gaza's health ministry. In reading, the nation's students are still stuck in a pandemic slump. When it comes to reading, the nation's 3rd through 8th graders are still mired in a pandemic-era slump. According to new testing data in math, the news is only a little more disheartening. Student achievement in those grades either held steady or improved slightly. Though all grades remain behind performance levels of same grade students in 2019. The data comes from NWEA, a K-12 testing and research organization, and its spring 2025 MAP growth assessment. A suite of tests taken by millions of students in thousands of U.S. schools. Math is crawling back, however modestly, but reading isn't budgeting, says Karen Lewis, Vice President of Research at NUE. I know people want this chapter to be over, but this data reminds us it isn't. Looking away won't make the problem disappear. It means accepting these outcomes are permanent. That is not an option. NUE is also unveiling a new tool that will be publicly available. A performance dashboard meant to help student leaders and policymakers understand how their students are faring compared to a broad, representative sample of the country. Reading scores remain stuck. There's little good news in the spring 2025 reading scores. They might show slight gain across This stagnation is consistent regardless of race, ethnicity, or school poverty level, NUE said in a press release. Math scores rebound slightly. There's a little more room for optimism in the spring 2025 math achievement data. Students in several grades made slight gains compared to the same age groups in 2024. Most grades have also shown slow but steady improvement since 2021. One more positive, the improvement in math achievement has come across student groups, regardless of race, ethnicity, or socioeconomic status. Unfortunately, in spring 2025, no grades were performing in math at the level seen in 2019 before the pandemic. NUE's takeaway mirror similarly worrying patterns highlighted by federal data, released earlier this year as part of what's known as the nation's report card. A new performance dashboard, NUE has also released a new public-facing dashboard for schools and politicians to gauge where their local students are performing relative to the rest of the country. The dashboard will be updated with new data 3 times a year, far more often than comparable data from the nation's report card, which only comes out every 2 years. Tom Kane of Harvard University Center for Education and Policy Research likens these rounds of student achievement data to helpful health checks to see how students are doing. 2 years is too long for American students to go between doctor visits, especially when recovering from a major injury, such as occurred during the pandemic, Kane says, calling the data available through this new dashboard an essential complement to the nation's report card for tracking students' recovery. Megan Kuffeld, Director of Growth Modeling and Data Analytics at NOI, says given the unevenness of recovery within schools and classrooms, national trends like these are an important first step to understanding where to dig deeper at the local level and ask critical questions about the necessary support and resources. The move to give districts and states more data to help inform their decision making, including on whether and how to spend scarce school dollars on academic interventions, comes as the Trump administration has gutted the Institute of Education Sciences, the division within the U.S. Department of Education that collects, analyzes, and publishes federal student achievement data.